Well, as we've been hearing all evening, Gauteng is in the grip of a dangerous third wave. Numbers higher than they've ever been in the previous waves, and we are at least 2 weeks away from the expected peak of infections here. The latest COVID-19 infection numbers have just been released. Over 9,100 people have tested positive across the country in the last 24 hours. Close on 6,300 of them are from Gauteng. 93 more people have died countrywide. Let's discuss this now with Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of the University of Kwazulu Natal's Research and Innovation Unit. Prof, thank you so much for your time. So those figures, the countrywide figures and the Gauteng figures, are slightly down. Is it just far too early to say that we might be heading in a downward direction?
Good evening, Sally, and to the viewers. No, absolutely. Those are just potentially just the daily variations. We really have to keep focusing on the 7-day averages in order to get a good idea of how things are going. And I think for me, Gauteng numbers are really interesting to observe because this is the first time in this whole pandemic that Gauteng is the first province to accelerate of the 4 major provinces. Usually it's sort of the last one to come on board. In the second wave, it was the Eastern Cape first, and Gauteng was the last one, which is also perhaps one of the reasons why it ended up seeing a similar wave to the first one, unlike places like Kwazulu Natal, where we saw twice the peak of the first wave in the second wave. So this is the first time that the sort of sequence is reversed, and Gauteng is experiencing this onslaught before the other 4 main provinces.
We've spoken to health officials tonight who've described it as a catastrophe here in Gauteng. Even our Premier sounds, he wasn't pulling any punches, just saying how really bad it is. Having said that, we are also a small, highly urban province with a lot of facilities, even though, of course, we've seen the disaster around Charlotte Maxeke Academic Hospital not being opened. What do you think from afar? And that perspective is always quite interesting. How do you think we're going to weather this wave?
Yeah, I mean, Gauteng, if you, for example, compare it to a province like the Eastern Cape, it's got a lot more private institutions that are not necessarily under the control of government, unlike what you might see in the Eastern Cape, where you've got a lot more public institutions, relatively speaking. But for Gauteng in particular, when we look at it, is that it's a mistake to think that you can fight the pandemic with hospitals. By the time you have to fight it in the hospitals, you have basically conceded defeat. We kept saying that, in order to fight this pandemic, you need to act before there is pressure on the hospitals. And it's the same thing we are seeing right now in Gauteng, where there was a delay in the response. And fine, we understood that there was a need to wait for the declaration of the third wave. But the point where you declare the third wave, it's already at a point where there's an acceleration of infections. That means that you need to resort to basically plugging the fight against COVID-19 with hospitals. And on top of that, we have lost leadership in terms of the Minister of Health, which obviously will filter down into the provinces. I was hoping to see a lot more sort of concerted leadership from the side of the province, and I feel like that has not really come through. Right now, Gauteng really needs to go back to fighting this pandemic outside of the hospitals with everyone, with the citizens, and not necessarily blame the citizens for the spread. That's an incorrect approach in my view.
How do you understand this delay? You've mentioned some of the reasons, but constantly we are told that the politicians and the people who organise the logistics and the running of health departments, they say they're constantly talking to medical and scientific experts to make the right decisions. So how do you understand what has gone wrong here?
No, the decision, Sally, it's a choice between having to respond with health facilities for disease that requires prevention. We're not dealing with you don't fight COVID-19 simply with curative services. But the nature of our health system is such that, we respond with curative services. So we wait for the infections to go up. We wait, and then when they're up, we try and respond. It's a bit late. Right now, for example, I'm expecting to see provinces like Kwazulu Natal, Eastern Cape, Western Cape being very aggressive in the way that they need to crash that curve before things get really worse. To wait is basically to wait at the end of on the other end for the wave to crash before you can respond. And I just think that this is what the delay means. The delay means that you wait for the infection rate to increase, then you start to respond, when actually you need to make sure that you slow down the infection rate. And so this is what our policy response has repeatedly failed to do. We keep waiting for the case numbers to go up. We wait for the hotspots, then we respond. That's too late.
Yeah, the virus is outrunning us. I have to ask you about the Beta variant, which is the variant first discovered here, and the Delta variant, which was first discovered in India. I understand that the Beta drove the second wave. It's still driving this third wave, but I also hear that the Delta wave is circulating in South Africa. So of the two variants, is one more infectious? Is one more dangerous than the other?
This is a very important question, Sally. Based on what we know so far, with the evidence that we have, we believe that the Beta variant dominant here in South Africa and the one that drove the second wave is still the predominant variant. That's what we know. But we also are aware that there are some delays in the sequencing of the samples. So it's possible that it may not be as high as the other variants. It may not be as high as we think if the other variants have started to take their place as well. But based on what we know, we still expect the Beta variant to be the most prevalent one. Now, in terms of the difference between the Delta, the one that was predominant in India and Nepal and so forth, we know that it is more transmissible. It spreads faster than the Beta variant based on the information we have. It's spread faster than the Alpha variant that was dominant in the UK. However, the Beta variant is really problematic because it escapes the immune system. This is where the problem is. And so we must not take the Beta variant dominant here in South Africa for granted and say, well, it's not as highly transmissible. It's still transmissible more than the original virus. But even more concerning is this concern around the fact that it can cause breakthrough infections, even when there is some immunity that has been developed. And so we must not necessarily allow it to continue to spread and continue to evolve, because then that can create new problems for us in the future. So just to note that, Sally, that yes, it's important to think about these things. We don't want any of these variants of concerns to spread, but at the moment, the variant that's dominant here is also not a variant that we must take for granted.
Absolutely. Thank you so much. Professor Mosa Moshabela, Acting Deputy Vice-Chancellor at the University of KwaZulu-Natal's Research and Innovation Unit.